Good afternoon, recruiting staff. My name is Annabelle Clarke, and today I'll be interviewing for the role of a postgraduate registered nursing position. I understand as a newly graduated nurse, it is an expectation to take part in many different types of workplace advocacy. The two that I would like to talk about today is patient advocacy as well as advocating for oneself. More specifically, I'll be talking about self-advocacy in the context of maintaining within my scope of practice. So, scope of practice involves the competency and education of a registered nurse when they are performing specific tasks. My scope of practice pertains to past clinical experiences where I would have been conducting tasks under direct supervision of a registered nurse and my clinical facilitator. So, an example of self-advocacy involves if I'm not comfortable with performing a task due to the fact that I had not done it on clinical placement, I would ensure that I'm accessing educational resources such as clinical nurses, team leaders, or nurse unit managers to clear up any uncertainties that I may possibly have. I'd also have a look at relevant databases, so policies and procedures, to make sure that I'm working under the standards of my registration, as well as practicing within the guidelines set out by the healthcare facility. Furthermore, having a growth mindset facilitates our resilience and learning when I'm performing new tasks, and I believe that it creates great accomplishments as a new leader. Also, patient advocacy to me is one of the most important components to nursing, as it allows me to create a safe and trusting environment between me and my patients. I think that working as a new graduate nurse means that you should be working collaboratively not only with multidisciplinary teams but also with the family members of the patients. Using the Nursing Midwifery Board of Australia Code of Conduct and Ethics as a guideline, I find that as to be a strong foundation in order to ensure that patient safety is optimised and that their wishes are acknowledged and heard at all times. An example of this would be that if a patient was saying that they were not comfortable with the medical procedure, however, treating teams were strongly pushing them to take part in this, I feel as though it's my responsibility to ensure that their wishes are respected and heard, as well as liaising with other members of the healthcare team to try and create an individualised plan and care for them. In doing this, I'm providing compassionate care to my patients, as well as creating a trusting relationship and advocating for them.